Hello everyone, today's topic is going to cover bariatric surgeries in general. We will start by defining or the definition of bariatric surgery, a little bit of history, how they have evolved throughout the years. Then we will move on to the categories and different types, and I will mainly focus on the 3 or 4 types that are very commonly used nowadays. Then we will shed some light on some of the nutritional interventions regarding bariatric surgeries, and then a little bit of a summary. And I hope then we will have an idea about what bariatric surgery can do to treat obesity. Now, we know obesity is a very global, dangerous pandemic, and it's expected that within the year 2030, we will have more rate or higher rate of obesity. So far, the prevalence is 1 billion people living with obesity, but it's actually an economical burden, and it's also a burden on the healthcare system. So that's why there are many ways to target and treat obesity. Beyond the lifestyle modification, exercising, and pharmacotherapy, the emergence of those bariatric surgery became one of the common ways to target super obesity, and it is just very invasive. So it's one of the last tools to be used to create a motivation to lose weight. So little bit of history. Bariatric surgery started in the 60s when a physician noticed that when we alter the GI system, there was a side effect of weight loss. So it was used to treat other GI symptoms, but they realized that we can still use it for weight loss. So within the 80s, they started to use gastric bypass, which is the very first bariatric surgery that was invented to treat obesity with under certain criteria. And within time and the emergence and the of obesity, it has increased, and there's a lot of a medical advancement in the field and the use of robotics. Now we have many different types of bariatric surgeries, like gastric sleeve, like gastric banding, balloons. So, and I think they are also working on to improve it further and doing it in a less invasive way. Nowadays they do it laparoscopically with robotics, but they're still working on it. So that's a little bit of history. Let's do now the definition of bariatric surgery. Bariatric surgery is when the physician alters the GI system, whether it is the stomach or the intestines, to create a condition of either restricting the food intake or restricting the absorption of certain nutrient that leads to weight gain. So we have two categories, either restrictive or we have malabsorptive, or we can combine both in one surgery. So generally speaking, bariatric surgery is creating a barrier for either eating a lot or creating a barrier for absorption of certain nutrients that leads to weight gain. That's the general definition, which takes me to the criterias. Criterias for a bariatric surgery: either the surgery can be restrictive, and that includes sleeve gastrectomy, or it can be malabsorptive, like certain types of duodenal switch or bypasses, or it can be both, combination of both, which is the Roux-en-Y bypass. Now that I have talked about different types, before we dig into the details of these types of surgery, I want to say what are the eligible criteria for bariatric surgery. Not everyone can actually go for those surgeries. First, in order for the person to be eligible for bariatric surgery, which is invasive, they have to have a body mass index of 40 and above, or 35 with a two conditions, metabolic diseases, diabetes, hypertension, sleep apnea, something that can actually worsen their condition, and the need for weight loss is really essential. So that's considering the BMI, which is the weight in kilogram divided by the height in centimeters squared. If it's more than 35 with any conditions, metabolic diseases, or 40 and above, the person is eligible for the surgery. Now, also another thing for eligibility criteria is that this person has to have tried many weight loss method, lifestyle modification, dieting, exercise, pharmacotherapy, and failed or regained. So different trials of a failure, that's when make them more eligible for a bariatric surgery. Another important factor here is that they should not have a lot of psychological problem, and if they do, they have to treat them or get a psychologist involved during their journey. So these are the eligible criteria. So far I have mentioned the definition, the different types in general, and the eligibility criteria for bariatric surgery. I hope I made myself clear so far. So if anybody has any question, feel free to stop me and ask me, or we can move on and continue. So moving on, now that we have talked about the different criteria, let's break them down to first the restrictive surgery and then the malabsorptive surgery, or both. Restrictive surgery nowadays, in the 2000s, became the most commonly used surgery to treat obesity, like sleeve gastrectomy. In sleeve gastrectomy, the surgeon laparoscopically within a small holes in the stomach and using robotics enters into the GI system, make an incision or cut the stomach, especially the fundus part, which is the round part that is responsible for secreting a lot of the hunger hormone, which is known as ghrelin. So when we remove 70 to 80% of the stomach, we have created a smaller pouch. Think of a size of a banana. It's really like a sleeve or a size of a banana that can only hold a limited amount of food. Nothing is being altered in the intestine. It's just the stomach in this surgery. And it has been used before as the stage 1 of the bariatric surgery procedures, followed by the other ones that I will mention later. But since it gives good result, the people actually are reaching their target goal, it can be used separately without any other surgeries. That's the restrictive part. Another restrictive surgery is the gastric balloon. It's not very commonly used, but it's an option for people who doesn't want to alter their GI system physically. So what they do is they insert either one balloon or two balloons, depending on the size of the stomach, to create this fullness. So as a person eat, they cannot eat a lot because there is something in the stomach that's preventing them from eating. So in gastric balloon, we are just making the person feel full sooner. But in gastric sleeve, not just feeling full sooner, there is also an effect on the hunger hormone that is released from the area that we have removed from the stomach. So far, so everything is clear? Okay, now let's move to the sleeve gastric bypass, or the duodenal switch, or the Roux-en-Y bypass. There is also the mini bypass. Generally, they are either only malabsorptive when we rearrange the intestine in a way to bypass the part that is responsible for absorbing of fats, or we can actually alter the size of the stomach plus do this rearrangement of the small intestine to alter the absorption of dietary fats. Now in this type of surgery, the stomach size is going to be like a size of a baseball. So it's smaller than sleeve gastrectomy. And then there is rearrangement in the small intestine where the area that is responsible in absorbing the fat is bypassed. Now, this is more invasive than sleeve gastrectomy, but it is one of the most successful surgeries to treat obesity and also for diabetes. Both of them are actually have been proved to treat diabetes type 2 and also obesity. But however, this takes me to the next topic, which is the nutritional intervention after those surgeries. Whether it is restrictive or malabsorptive, the person has to follow a specific plan. We always start with a liquid diet, clear, followed by full fluids, and then followed by a puree or smash diet for a month, or depending on the person. And then we move on to eating small, frequent meals until they reach their goal. Now, the main thing here we have to be concerned of is the protein. Since the stomach doesn't accommodate large portions, we need to focus on the protein to prevent muscle mass loss and promote fat loss. We also have to think about the vitamins, especially B12, which is absorbed mainly in the part that we removed from the stomach. So we give them for life, B12 or B complex supplement, fat soluble supplements in the malabsorptive procedure, because the area that has been bypassed is also responsible in absorbing those vitamin A, D, E, K, which are fat soluble vitamins. So those person in general have to eat high protein, maybe a protein supplement, drink plenty of water, because water is an issue for them to get at least 2 liters per day. Take their multivitamins and supplement with a vitamins, specific ones like B complex, like a sometimes iron if they have anemia. So they have to live forever on those supplementation and hydrate. Plus, we have to motivate them to do some physical activity to promote fat loss instead of a muscle weight loss. So now that I have talked about what are bariatric surgery in general, what are the different types of bariatric surgeries, what are the 3 most common types, there are more than just sleeve gastrectomy, bypass, duodenal switch, and balloon. There's also gastric banding, but I didn't go over it because it has been banned since it has a lot of a risk, put the person at higher risk, and also has a lot of a side effect that comes with it. We talked about some of the nutritional interventions that follows the surgery. And now I want to summarize by saying bariatric surgery has been proved to be a very effective tool in treating not just obesity, also diabetes. Maybe it's the only tool to treat diabetes treatment, not just like resolving the symptoms. And also, bariatric surgery is important. However, we need to follow a strict nutritional plan afterward with exercise. If we have any underlying issue, medication, psychological issue, we need to also target those. It's not the magic stick that will make you lose weight and be happy forever. You have to keep the weight that you have lost. There is a possibility of regain. So it's all about eating healthy, making the right food choices, not just the surgeries. The surgery is only a tool for motivating and to give you this push toward becoming a healthier version of yourself. It doesn't replace eating healthy. It doesn't replace physical activity, but it is actually very powerful in motivating those people. I hope everything is clear. I made it really simple with targeting the main point. So feel free to ask me any question regarding bariatric surgery or nutritional intervention after bariatric surgery. Thank you so much for listening. Bye-bye.